Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Bostix Series. This audio podcast as part of a LaBox Infaction. This audio podcast as part of a Storm Quota, and this audio podcast as part of a Storm LaBostics production. In this audio podcast, as part of sort of drafted works from early 2023. Now looking at sort of the results, the analysis, and the results of this works. So quantitative data was analyzed descriptively to inform frequencies of variables and differences between variables. Quantitative analysis helped identify if there is a role for allied health professional or AHPs to support patients with chronic kidney disease or CKD in primary care to establish any correlations against similar research. All quantitative data was analyzed using Qualtrics software, which was the sort of academic institution's approved software service for quantitative research. Equally, Qualtrics software helped quantify data numerically and help understand whether there were any statistical significances. Qualtrics software was also the only online survey software validated and authorized for this and sort of similar works for similar works. It initially 14 topics or themes and tags helped investigators and platform leads to co-develop two surveys to help fulfill the aims and objectives. So in around the sort of the analysis. So the research team sought to collect baseline data relating or regarding the following themes between two cohorts. That's two cohorts, i.e., service users and service providers. So in around the service users, the following questions, the following sort of questions were sorry, the following themes were posed. Number one, it was in regard to describing a CKD, chronic kidney disease status. Number two, perception of CKD or chronic kidney disease in primary care. Number three, received whether there had been received extended sort of education. Number four was around future models of care. And number five was CKD and primary care education. Number six it was in around tech and digital healthcare. Number seven was in around information, communication, and technology, or ICT. Number eight was in around appropriate support and surrounding healthcare access. Number nine was in around healthcare communication and support. And number 10 was in around influences on taking ownership. Number 11 was in around online learning and care. And number 12 was in around gender. Number 13 was in around age, and number 14 was in around ethnicity. Now, some basic data. The manuscript goes into the analysis, or descriptive analysis, into some extensiveness. However, some analysis is as thus. So CKD patients that contributed the highest included transplanted patients or recipients in around 60.53%. Second were end-stage renal disease. Those were specifically on hemodialysis in around 13.16%, and patients with CKD stages 3 through 5 in around 10.53%. The lowest responses included CKD, those with CKD, kidney disease in suspect and high risk, which was which where there was 0%, and CKD stage 1 through 3 in around 2.63%. A total of 38 responses were identified or established from this from the initial questions in regard to in regard to the description around CKD, chronic kidney disease status. And then the second and the highest response included it was in around a question and around a response to a question. I have ability to communicate with a healthcare professional about blood tests and investigations, which was in around 25.49%. The second highest response included healthcare professionals was in regard to a question regarding healthcare professionals should be prompted for more patient based activities in around 23.53%, and in response also a similar response rate was a similar response rate or percentage was in around a question around in around a response regarding I have links to patients with chronic kidney disease for peer support and so where I can share experiences, which the response rate or percentage was again was similar as that of the previous as the previous second highest response being 23.53%. Now, in around the healthcare professionals, the following questions were posed. Describe your profession, perception of primary care, extended education provision, future models of care, CKD and primary care education, healthcare professionals and electronic healthcare records or patient records, primary care and electronic primary care and electronic patient records, information communication and technology and digital healthcare, allied health professionals and future roles. Number 20. And another question was in around skill mix and leadership. Another theme was in around safety and governance in primary care, as screening and biomarkers, and then also gender, age, and ethnicity. So two of the highest responses relating information communication and technology included one of the principal roles of healthcare professionals two of the highest responses relating information communication and technology included one of the principal roles of healthcare professionals are using information communication technology or ICT in around 16.67%. And then secondly, sort of technical issues is a barrier to ICT or information communication technology with 16.67% as well. Second highest response relating ICT was where healthcare professionals unwilling to utilize or contribute through information communication technology or ICT, 11.11%. Two of the highest responses relating in regard to future roles of AHPs were AHPs will increasingly work with general practitioners to provide laboratory screening and point of care testing advice and or education, and where the response rate was in around 16.67%. And then healthcare scientists and and allied health professionals, or AHPs, deliver more NHS professional services such as educational support, understanding of disease trends, and medicines, include in around 14.29%. The question with the third and fourth highest scores were AHPs will provide more supplementary education and healthcare promotion services, 9.52%, and AHPs will support GP practices, general practitioner practices more efficiently and streamlining practice, and where the response rate or percentage was in around 9.52%. Three of the lowest responses included patients will have access to allied health professionals through educational podcasts or webinars in around 2.38%. In around at the same time, the lowest response also included patients will have access to allied health professionals through a smartphone or for supplementary education and support in around 2.38%. And patients will have access to allied health professionals through social media or instant messaging apps for supplementary education in around where the response rate was 2.38%. The manuscript goes into more details, and there is sort of graphical and tabulated information. However, what was just iterated was just an overview of some of the analysis of the works. So that draws this audio podcast to a close. This audio podcast as part of a Bostix series. This audio podcast as part of a LaBox Infaction. This audio podcast as part of a Storm Quota. And this audio podcast as part of a Storm LaBox production.